welcome back, listeners. This is our fourth and final episode. I'm your host, Tiffany Silva Herlin, a licensed clinical social worker, and today I am excited to finish up this discussion we've been having with Allison Jenkins, who is a licensed clinical social worker as well, and also clinical director from OASIS Ascent. Please remember that this podcast is not a replacement for therapy. Please always seek a mental health professional for your situation. For this particular episode, we're going to be discussing what role does residential programs play in autistic diagnosis and support? Like, how do you know that you need a residential treatment program? What is that the next step? And we're particularly going to dive into how OASIS Ascent program provides a comprehensive evaluation, stabilization, and intensive support for neurodivergent individuals, particularly females. So let's get started and bring visibility to the unseen spectrum. What are some of the challenges families face when trying to get a proper autism evaluation in outpatient settings?
Yeah, there's so many challenges. Cost, right? Cost is one. When you're getting an evaluation, you're doing the standard battery, and then you're adding on the ASD testing, right? You cannot just go to a psychologist and say, hey, I think my kid's on the spectrum. Can you do these batteries? It has to be a combination of multiple batteries. And again, I am a licensed clinical social worker. I cannot diagnose autism. I can refer, I can yell at the top of my lungs, this is what I think. And at the end of the day, the psychologist is going to collect all the data. And so cost is one. Finding a psychologist, most psychologists for testing, especially in Utah, are 6 months out, getting on wait lists.
Big, long wait list.
Talking to your insurance, seeing if insurance will pay for it, right? That's always an option. And then, of course, if your insurance will pay for it, there's a longer wait because more people are trying to get in to get their kids tested with insurance. A lot of the girls, they don't present on the spectrum. So schools are very hesitant to test, right? For an IEP or things like that. Outpatient providers aren't really seeing it because these girls mask for an hour.
Yeah, they're only getting a tiny glimpse.
And so the therapist is calling the parents saying, oh, everything's great. And the parents are like, yeah, no, not everything is great.
Yeah.
Like they're having these big outbursts.
Well, even the tester's only spending, a couple hours for a day or two, like you were saying before, to actually do the evaluation.
Yeah, they're spending, they should be spending 2 days and they're collecting all this data. And so, a lot of times it needs to be a team of people. And as hard as it is, the kids sometimes have to be removed from the home. And to get those eyes on your child, to be able to observe in all different settings, socially, in school, in therapy, in the community. And so I think, sometimes as hard as it is, removing your child from the home and putting them in an assessment center could be the best thing. And at OASIS, we work with all insurances. We are 99% insurance funded.
Which is amazing, because not all residential treatment programs do that, or can do that. Yeah.
And then especially at OASIS, we offer the psychological evaluation to be included in the treatment, right? And so unfortunately, we do not offer to pay for an ADOS.
Yeah.
And the additional testing.
Not everyone needs it.
Not everyone needs it.
So it's something that's requested. That makes sense.
And at the same time, it's so important, right? It's so important, absolutely. Especially if we're recommending it.
Yeah. Let's take a step back and say, for our listeners, what signs would they be looking for, or how do they know that they need to take this next step?
Yeah, that's a really good question. I always look at 3 points, right? I look at how they're doing socially, if they're failing socially, if they're really struggling socially, how they're doing in school, right? If they're, how they're, and sometimes school, it's a double-edged sword because we get the students the perfect students, right? That are doing everything right.
They may be doing great in
school, and socially they're, really struggling. And then in their home life, right? What does the relationships look like? How are they struggling at home? And then of course, safety. A lot of times, safety is a big factor. If you're starting to worry about locking up sharps, if you're worried about the safety of your other kids because of big outbursts, if you're worried about your safety, and if you're worried about your child's safety, then that is they need a higher level of care.
Yeah, no, that makes sense. And what resources can they find or use to find a place like OASIS?
There are people called education consultants, and education consultants I love because you can find them. They're very, very smart. They've gone to all of these programs. They've vetted the programs. They know your child's going to be safe there. They know your child's going to be taken care of. They know the clinicians a lot of times, where they know which clinician will fit with your child. And so these education consultants are a great resource to finding a good place. There's a lot of short-term programs that are popping up that are saying, they're doing assessments and stabilization. And it can be really confusing because there's a lot maybe in your area, and then maybe, going to Utah seems too far. And a lot of times the ones in your area have maybe not been vetted and you're not sure. So education consultants are great to help with that.
Absolutely. I've worked with so many of them, and they can be an advocate for the family and also kind of a middleman, and help with, it's such an overwhelming world once you step into it and realize, okay, we need this, to even know where to start.
Right.
And they've done all that work for you. So worth your time and are such a great support for our families looking for help when they're in crisis. Mm-hmm. So what makes OASIS different from other evaluation residential centers?
Yeah, that's a great question. I love OASIS. So OASIS is kind of a hybrid. It's very interesting the way we designed it and when it was first started. OASIS stands for Observation, Assessment, Stabilization, and Intense Support. So what we're really doing, there's a lot of assessment centers where they just go in and they'll observe, right? Not a lot of treatment, not a lot of therapy. And at OASIS, we do both. So we are observing, and then we're starting to treat right away. We're doing heavy, heavy clinical services. We do 10 clinical groups a week, sometimes more. We're doing, 3 to 4 sessions a week. And these kids come in and they're struggling and they need that, right?
Yeah, they don't just need an assessment. They need the hybrid of assessment and therapy at the same time.
Correct. And that's where we see the most traction, right?
Yeah.
And so we're observing them in all these different settings, right? How are they doing in school? How much school are they doing? If they're distracting in school, if they're engaged in school, then we're looking at, the medical piece. What does their physical health look like, right?
Yeah.
How do we help it when they have really severe stomach problems all the time, right? Or, how do we support them physically? And then we're looking at residentially, right? Their interpersonal skills, what they're doing in the milieu, how they're transitioning, how they're doing their ADLs, we're looking at all of those factors. And then we're doing the clinical, where we're diving in and starting the clinical with family therapy, right?
Yeah.
We start family therapy right away. We've encouraged families to come. We're not a program that's like, oh, you can't talk to your kids for 2 weeks. We're encouraging families to come because it is a family system.
Yeah.
And we need to see, you guys need to come on campus because we need to see how you're going to interact in the family system, and we want to support all of you. So that's what makes us special, I feel like, and different from others. Is because we're really assessing and treating at the same time.
When you guys are taking such a comprehensive look at the whole picture and the whole student and their family. Mm-hmm. You're not just looking at their mental health, you're looking at the physical and the education and the social, every aspect that makes us human that should be integrated and will allow for better understanding, assessment, and healing.
Correct.
Yeah, that makes sense. How does observation and assessment help with evaluating one of your female students with, for autism who comes in possibly misdiagnosed?
Yeah. We are, we're observing 24/7, which means the mask has to come down. The mask will come down.
Yeah. Absolutely.
And we're, especially like their social interactions and interpersonal interactions, we're able to observe that more with the milieu, who they gravitate towards, who they don't gravitate towards, what they're doing in their free time, how many shutdowns do they have a day, how many outbursts do they have a day, right? We also get something called an extinction burst sometimes with our spectrum kids, where transitions are really hard. Change is really hard.
Explain that extinction burst, because I love that analogy.
So the extinction burst is when kids come in and they are really struggling with the transition in the beginning, and they could have some really big behaviors, and it goes up and then it bursts and it comes back down and then they stabilize. So we're ready for that, right?
Yeah, so sometimes things get worse and harder before
they get better. Correct.
Especially if you are holding the boundaries and kind of pushing them in the correct direction and hitting on things that are hard for them.
Yeah, hitting on things that are hard for them. Yeah. And change, right?
Yeah.
Change, transitioning, especially, if you're nervous about, flying your child from California to Utah. I mean, that is a change, and that we're ready for it at OASIS, though. We're ready for those extinction bursts, and we're looking for them, because that is another good clue for us.
Yeah, that makes sense. What does a high quality evaluation process look like in a residential setting such as OASIS, especially for a female student who may be misdiagnosed and have autism spectrum?
Yeah. So, the high quality, what we do is we're always being thoughtful to when we're testing, right? Do we want to test a kid right away that's in the middle of extinction burst? No, we don't. So as clinicians, and we're all looking at when the right time is for the testing, when we think they're kind of getting to their baseline, when are they safe? When are they willing to engage, right? And so it's a tricky, delicate balance that we're working with the psychologists and our team of psychologists of like when it would be thoughtful, when we have enough information as well to be able to provide, right, as clinicians, to get the accurate diagnosis. And so it's very thoughtful, delicate balance that we do with all of the kids. And it seems to work. We want to get we want to get the most accurate data.
Yeah.
Right. And so we're always looking at when that window is to squeeze in the testing.
And not to force it, right?
And not to force it. Yeah. Because the testing can be rigorous. There's 400 questions on one of the tests. And so we have to look at that and be mindful, like when we're giving a testing packet and we're having the kids work through it, like where are they at? Who's going to help them and support them when they're doing it, right? And where are they at emotionally?
Yeah. So let's talk about providing the right support. How does OASIS tailor therapy and support the neurodivergent female students that you work with?
The great thing about OASIS is diagnosis or no diagnosis, we're still treating the symptoms, right? And so even though we don't have the diagnosis yet, but we're all like, okay, we think this is what's going on, we're starting to treat right away. I did talk about DBT. I love DBT. A lot of interpersonal social skills. Like I may have a girl that will come up to me and, she break my boundaries. She will come right up to me and stand right in my face. Allison, can I get my packages today? It's like helping them understand social skills, helping them understand, appropriate interactions, and helping them take their mask down, right? And helping them understand that behind their mask, they're beautiful. They are beautiful humans and they can be themselves. And so I think we're, even though we may not have the diagnosis, it may take 45 days, we're still treating what we're seeing and pivoting and really like just supporting them with strength-based, how to build on their strengths.
I love that.
And then, helping the parents understand how to build on their strengths, right? And so we're still always talking about that,
and probably still loving and accepting the child they do have versus the one that they wish they had or dreamed they had or things like that, right?
Yeah.
Helping them come to terms with where things are at.
Right.
What does stabilization and intensive support look like during that process?
Yeah. So, we have our ratio we're 3-to-1. We have the ability to provide levels of support that a lot of places are not. We are a locked facility. Some of our, girls, spectrum girls, they're runners, right? It's a fight or flight thing. And so we're a locked building, although we do a lot of off-campus activities when the girls
so
are
they
safe.
are allowed off campus.
Oh, yeah. They're off campus I want them in the community practicing their skills 3 times a week, especially their social skills, right? Like sometimes they'll go to restaurants and I'll practice ordering, right? Sometimes they go to do community service. Like there's a lot of assisted living facilities by our campus, and so the girls will go and play games, or they'll polish nails with the assisted living, just getting them out in the community. And then of course we want them using their skills and doing appropriate social interactions, and then coming back and talking about it, right?
Yeah.
Especially the negative scripts that run through their mind of like, oh, I didn't say this right, or oh, I should have done this better, helping them process through that and understand. But the intense support too is we do staff trainings once a week, and they're clinical in nature. And sometimes we can focus on specific students that we need to support, right? We come together as a clinical team, and as an administration team if we have a student that needs more support, and we brainstorm like, where are we failing the student? Not this student isn't a good fit, we need to get rid of the student. We're always looking at like, what can we do better? Where are we failing the student? I
love that. And I love, again, parents listening, you're hearing that this whole team and community comes to support this one student, and it's not it's not on you if you feel like you've gotten to this point where you need a residential treatment, you need a more thorough evaluation and comprehensive assessment, that it does take a whole community. And it can't just always fall on just you.
Right.
You need a bunch of people and constantly evaluating what can we do differently to help better meet their needs.
And it's not easy when you make the decision that your child can't live in your home anymore.
So, yes.
It is the hardest decision, one of the hardest you'll ever have to make. And at the same time, it can be very beneficial and rewarding, and it can change the trajectory of your child's life to get an accurate diagnosis and to understand how her brain works, right? Like we get girls that are super, super smart, but with a really low processing speed. Like that, understanding that it takes your kid longer to process through something, and to give them time when you're saying like, okay, I need you to clean up your room and then brush your teeth, and then you need to go to school. And like if you're giving them all these demands at one time, it's like learning the simple thing of asking them to do one thing, then when they finish that, then you're asking them to do another thing, and then they're processing through it and finishing it. I mean, that...
I could take a class on that. I'm sure my kids could tell you I need that better as a parent myself. So yeah, those are important things I think any parent could benefit from. And that leads me to the question of, what does a family involvement look like, especially for understanding autistic diagnosis?
Yeah, the family involvement is education, psychoeducation, and just coming to OASIS and experiencing your child through a new lens, right? It's looking at it through a different lens, and that lens is so beautiful and magical, and embracing that, right? And I think that's so important that the parents just learn as much as you can, do your research, dig into it, get support, go to support groups. And at OASIS, we can provide that.
Like, and say, what does OASIS provide?
So
do they do family therapy?
Oh yeah, I'm sorry. Yeah. So OASIS, we do family therapy weekly.
Yeah.
It's required. In fact, we've had parents want to send their students to us, but they're not really engaged in family therapy. And that's not a good fit for us. It's really not, because we need the whole family system. As we're getting ready to transition home, we bump up to 2 family sessions a week, right? Parent visits are very highly recommended. As much as you can come and be in person, the better, because that will naturally improve your relationship with your child, right? We're not a program where you can say, oh, go to OASIS and they'll fix you. It's like we're helping the whole family, and they need to understand
Well, and that provides lasting change, because
Yes.
what happens is if you only fix one individual in the family system and then
Right.
send them back to the same system, they're going to mold back in to
Right.
shape into that role that they once carried.
Right.
So if you're not looking at the whole family system,
Right.
then you're not promoting long-lasting change. And honestly, I can say this as a therapist, like we don't want your child to be at our program forever. Yeah. We don't want to be a therapist for you forever. Like we want you to move forward. We want you to graduate. We want you to have a second chance at life as individuals, as a family system, to thrive and move forward and progress.
Right. I mean, and it's happened where we've sent kids home to the same family system, and I get calls 3 weeks later, hey, can she come back? Right?
Yeah.
Because it's just, so the family needs to do their work too. And it's a challenge. It's like nothing we're asking you to do is easy at OASIS, and nothing we're asking your daughter to do is going to be easy. And at the same time, through challenges, we grow. And through struggles, we grow. And it's just at the end, after, 75, 85, 90 days, you'll see a different child. You will.
Yeah.
And you'll have answers that you've been wanting your whole life.
Yeah. So how can a program like OASIS help individuals and families move forward after a diagnosis?
So what we really do is do a lot of community outreach, right? Like what school is going to be the best fit. We work with the teachers to be like, okay, come up with a plan of like, now you've been working with this student for 3 months. What would be an ideal school? What would be an ideal setting? Helping the parents navigate that. Of course, therapy, right? What is therapy going to look like? Who is a good therapist? Sometimes the parents are like, oh, they've been seeing this provider for 10 years. We want to go back. I'm like, and we've got to change it up. We've got to mix it up, right? What we were doing was not working. So what are we going to do moving forward?
Yeah, which is only the definition of crazy, right?
Right.
Trying to do the same thing over and over again, expecting different results.
Right. And they'll be like, well, she likes her and she goes every week and they connect. I'm like, let's try something new, right? Yeah. It's not a diss on anyone that has been trying to help kids, but I'm just, we just got to, sometimes we got to throw everything out we've been doing and start totally from ground one, especially with treatment. There's a lot of neurodivergent schools, smaller classrooms. But what we do at OASIS is we really help find wraparound services, right? Like, what are you going to need when you go home? Parent coaching. Parent coaching is becoming a big thing. A lot of, professionals that have been in the field a long time are turning to parent coaching, finding good parent coaches. What does that look like?
What is parent coaching for our listeners?
Yeah, parent coaching is where, and I do it at OASIS. We do parent coaching at OASIS. I should say that, but it's where we get both parents, and then I'm coaching them through different scenarios that could come up and how to respond appropriately, and how to reflect, and how to respond differently to your child.
Yeah,
and how to get along and be on the same page.
So better communication, better support, better connection.
And for the divorced parents out there, I just, I really try hard. If there are divorced parents that are not getting along, those are the ones that are definitely calling together for parent coaching. And it's not easy. And so that have them be on the same page.
Co-parenting is so hard, having to do it myself in a divorced, situation. Yet it's, your kids deserve it. It is absolutely essential to your kids' ability to thrive and function and move forward into adulthood. So you got to put the past behind you and move forward for your kids.
Yeah, I've worked with parents that, maybe one of them even had a restraining order against the other one. And I was like, we are coming together because this is going to show your child how much you love them.
Yeah.
And when I told the student, I'm like, oh, I'm doing parent coaching with your parents. They were like, I'm like, that's how much they love you. They are going to come together and talk and get along because that's how much they love you. And they're just like blown away. I can't believe it. They've never gotten along. I don't. And then they're always like, I don't know how you're going to do it. I'm like, oh, I'll do it. And I do it. And
That's
so
awesome.
we do offer parent coaching at OASIS. I run a parent support group every Tuesday. It's an amazing group. We talk, I usually will teach a DBT skill, and then we have a topic that I think is relevant that I'll talk about. And then we open it up to processing or other topics. We talk about everything from regression, progress, insurance, loneliness. Like, a lot of parents feel guilt when they send their children away because there's no chaos in the home, and they feel like they're settling into a home without their child with chaos, helping them work through that. There's just so many things. And it's a really supportive group, and they end up exchanging phone numbers and becoming friends long after leaving OASIS.
And that's so essential to parents' journey of healing, is finding other people who are going through similar things and realizing, A, they're not alone, and B, they're not failures. And, and lastly, that they can make these friendship and connections that are going to be so beneficial to their own healing journey.
Right.
Yeah.
Right. And that you're not alone. You are not alone. And that's the one thing. It's like the parents that come, that's the theme, is like, I just felt so alone.
Yeah. It's so isolating.
And so isolated. And everyone else, their kids are going to prom, or their kids are applying for colleges. It's their junior year, and here my child is in treatment, right? And
on top of it, just maybe got an ASD diagnosis.
Yep.
Which is a whole nother layer to work through. Allison, to finish up this mini-series, can you leave us with a story of success of a family you've worked with?
Yeah, I'd love to. I had this girl that came in. She was really blowing up at home, and she would go to school all day, right, and do really well, and then come home and just
unravel.
And it got to the point where she was being really physically aggressive with her mother, right? And the mother had to move out of the house. I mean, they tried to really maintain it in the home as long as they could, right? When the education consultant called me, it was another question mark kid. Like, this kid, she does well in school. She's really bright. She can be social. She burns through friends. She's self-harming. She's, aggressive towards her mother. Multiple diagnoses, been in treatment since she was 5 in outpatient therapy, because her mother always felt that there was something different, right? The mother was like, yeah, there's something going on. I talked to the mother, and the mother was like, this is borderline personality disorder. She has it. And I'm like, okay, well, she's 14. So, and she was, reading me all of the things she's doing and everything. And in the back of my brain, I was like, oh, I bet she's on the spectrum. So parents finally chose to bring her to us, and we started treatment. I was her therapist. We started treatment, and I started working with the family. Dad was very, very rigid as well. She got along well with Dad, surprisingly. Did not get well with her mom. Mom was they're lovely parents, but Dad was very rigid. Got along well with her dad. So we started doing the work, and we started doing an evaluation and an assessment, and it came out that she was on the spectrum. Mom was so relieved, and at the same time was facing this autism diagnosis of like what to do next, right? She'd been in really neurotypical schools, and so the education consultant made a referral to a long-term program that specialized in neurodivergence. She went there. Mom was still really afraid to have her go home, right, because of the aggression. So she went to this long-term school, did really well, and then graduated, and now she's at a boarding school, just thriving. Sometimes she'll call me. It's so funny. She'll just call me and thank me and give me updates on how she's doing. Her parents, invited me to her graduation at the neurodivergent school she went to, and she's doing well. She's doing great. If she wouldn't have had that diagnosis and had Mom leaned into the borderline, she would have ended up at a completely different treatment center, and she would have been kicked out. And she would not have
probably
thrived.
Had even longer.
And had been in treatment longer.
Treatment.
If we hadn't have got that diagnosis, because Mom was so sure it was borderline.
Yeah.
And it presented as borderline. And that's the validation, right? And that's what we're doing at OASIS. It's like, that's the validation to the mom of like, yes, it does look like borderline. And at the same time, autism can look like borderline with females. Mm-hmm. And so helping Mom understand that. And then when they went to go to next steps, the education consultant could place her in a program where she could thrive rather than in a program for borderline students with attachment, right? Or, where she would be eaten alive and she wouldn't know what to do and she would blow out.
Yeah. And possibly, not get the true help that she needs.
No.
And maybe even do more harm than good.
And be passed around from program to program, right?
Yeah.
And I've seen it like, oh, she got kicked out of this program. She got kicked out of this program. She got asked to leave this program. And I'm just like, she is on the spectrum. She's in the wrong program.
Yeah. Well, and I love that you're sharing. You shared a story in our previous episode about a girl who was able to have short-term treatment with you guys and then go straight home.
Yeah.
And there are some cases where they need further treatment, but at least through OASIS, they're getting the correct treatment.
Yes.
Which does shorten the amount of time they probably would have needed it.
Yes.
So,
and I just want to say, like, you know, our goal at OASIS always is to get the kids home. Always. That's always our first goal. How do we get the student home? Even if parents are like, they can never come home again, or I'm terrified, we're always looking at how do we get the kid home? Because I think that is what the kids really need. I know there's long-term programs that are very helpful, right? And our goal at OASIS is always to get the child home. If they can't go home, then we do look at other alternatives.
Awesome. Well, Allison, thank you so much for joining us. And I can tell you're passionate about this topic.
Oh, yes.
I feel like more people need to hear about it. We need better representation in research for females, especially regarding autistic spectrum disorder. And honestly, just people more aware and educated on this specific topic. So thanks for coming and talking to me about it today and sharing your wisdom, your knowledge, and your experience behind it. So
You're so welcome. It's been a pleasure.